This is Sarah Mikesell with ThePigSite.com, and today we're here with Dr. Lisa Becton. She is the director of the Swine Health Research for the National Pork Board. So thanks for being with us today, Lisa.
Thanks a lot for the chance to talk with you.
Very good. Now, today let's talk a little bit more about the idea of diagnostics as part of total herd management, you know, that component. We've been talking today a little bit, and you've talked about a sick farm, not a sick pig, but a sick farm. Can you talk about how diagnostics can help a farm that's sick, I guess, essentially?
Sure. You know, when we do a check on the farm, just as veterinarians to come in and do an assessment, you want to look at how is the herd health overall.
Right.
And it may be a specific age, or, you know, is it a wean to finish? But if you do have a problem on farm, a lot of times it's not just one pig, it's multiple animals. And so then we utilize diagnostics to determine what is the whole herd being affected with.
Right.
And that can be a broad range of samples, whether it's looking at, you know, the necropsy of a pig to try to identify specific tissues, or blood samples, or oral fluid samples, or saliva. And so what we try to do is target our diagnostic testing towards what a producer is seeing. So if it's a respiratory disease, we'll do things like mycoplasma, pneumonia, or we'll look for swine influenza or porcine reproductive and respiratory syndrome. Conversely, if it's an enteric disease, you'll look for things like rotavirus or Clostridia, or even you know, PED right now.
Right.
And so the diagnostic part of it really helps to confirm the clinical signs that a producer is seeing on farm, and then it can also provide information on how do we manage this disease now that we know that it's there.
And when it comes to, like, obviously with your role with the National Pork Board, you guys are doing constant research. So what are some of those gaps that you guys are trying to fill to help producers long term?
There's a lot of different things that we assess. When we get our producers together, we'll ask them, well, what are your guys' needs? And a lot of times with our diseases, they may change over time, a little bit of presentation, or one type of disease may all of a sudden resurface when it's been, you know, not there before. So like swine dysentery. And so what we always are focusing on is how do we continue to improve our diagnostic tests? How can we utilize, you know, one test for multiple diseases, because then that will save you on cost. And then also looking at different things like next generation sequencing. How do we get down into the gene level of that disease? Because then that can give us a chance to survey it over time, see how something may or may not change. And so there's a lot of things that we will fund just in continued support of a lot of diseases to make sure our diagnostics are accurate, up to date, and cost efficient.
Very good. And the gene sequencing is just so interesting, because I would assume that's a huge part of your research, is seeing what's changing, right? Those mutations, I don't know if that's the right word or not, but how are these diseases changing over time?
That is correct, because a lot of, especially viruses, can change, because, you know, some of them are only single-stranded viruses of the RNA versus double-stranded viruses. And so we want to make sure that we can adjust for those changes, and, you know, through diagnostics or vaccines, and be able to manage those when they do change. And a lot of it is just being able to know what is happening over time, and are we having an impact when we prescribe a treatment or things like that.
Very good. It's art and science, it sounds like, almost as you're
definitely
watching these things. So very good. Well, thanks so much, Dr. Becton.
Thanks a lot. It's great to visit with you.
This is Sarah Mikesell with ThePigSite.com.